Good morning, everyone. My name is Susan McDonald. I'm the secretary of the board at NESHCO, and I represent Hartford Healthcare. Today, we're going to present boosting your Lamplighter entry because it is that time of year again. It seems to come quickly after the holidays every year, but it's Lamplighter season. And today we have like a little down and dirty presentation about how to apply for the Lamplighters. And we also have two members who are here who will walk you through their applications from last year. Mike Morrison from Mass General Hospital was the winner of the 2021 Best in New England Award, which is the top award given out at the Lamplighters. And then John Sponauer from Wheeler Health earned the 2021 Lamplighter Gold Award for television advertising and service line marketing. So they will be here to give you some specifics on their process and some insight into the applications. But I'm going to present the kind of guidelines that we've come up with over the last few years to help people craft award-winning entries. Next slide. Maybe the most important thing to know is the deadlines and pricing. The early bird deadline is this coming Monday, and there is a pretty decent discount if you get them in before that day. The standard deadline is the 31st, 2 weeks later, and then the final deadline is on Valentine's Day, Monday, February 14th. Those deadlines are all midnight on that day. Next slide. We always are looking to add categories, and so we have several new to 2022 categories that you might consider. The first is marketing technology. This is a category for anybody who used a new technology to improve or streamline functions in the marketing department. We'd ask that you outline the process by which the organization selected the new MarCom technology, implemented it, and adapted processes to it. As part of the application, you can share new processes or structures put in place to set a path for success along with results from your initiative. Next slide. Another new category is collaboration. If you've seen the promotions for the conference itself, the conference theme is collaboration. Collaboration is the main thing. MAINE because of our location in Portland. So we're really honing in on collaboration, which has become such an important part of our lives, ever more important during the pandemic. This is a new and limited time only category for your applications. We'll ask that you describe how you used a collaboration to produce a project or a series and why that collaboration was crucial to your success. The category encompasses internal coordination amongst your own team, across department collaboration, or a partnership with other organizations. We'd ask that you describe what tools you use, including online software, workflow strategy, and other communication techniques to achieve your goals. Next slide. Then we also have a new category, electronic marketing and marketing technology. This includes email, e-newsletters, and overall e-campaigns. We'd ask that you include an explanation of the list development, audience segmentation, rationale behind the use of electronic versus traditional media, and explain how you use marketing automation or other advanced automated triggers to support your campaign. Next slide. Those were the three new categories. So in all categories, we believe that good entries deliver on these big three items: strategy behind the project or initiative, the creative, meaning the thought processes, but also the collateral or the actual end results that you have to present, and then the results. One of the biggest challenges is developing results and showcasing how actual actual results, actual statistics that show that your work worked. Next slide, please. The anatomy of a lamplighter entry. These are the 4 categories. If you go on to the electronic version of the entry form, the 4 categories we ask you to address are situation analysis. This kind of sets the stage. It's just a statement of your challenges that you faced and the hurdles, and the answer is it answers the question why. Why are you doing this? Why is this project necessary? Why do you need to help in this situation? The second section is statement of objectives. List your key objectives and be very clear. Think measurements. This answers the what. So it's kind of like, and I know there's a lot of journalists out there that switch over to healthcare marketing, myself included. And so it kind of answers those questions: who, what, why, when, where, and how. And they all fit into one of these categories. Number 3 is the program planning and strategy. This is where you describe the thought process and decisions that you made. This answers the question how you addressed the project. How you made the project address the problem, excuse me. And then 4 is, again, the results. This is where you need to be as specific as possible. When there's an event and you say, people seem to have a nice time. And I've read those. We do a lot of cross-judging for other organizations. And I've actually read statements like that in results. And that's nice, and it's anecdotal. It's an anecdotal feedback, as it says here, is supportive, but numbers are much more important and much more impactful. Next slide, please. The rules of submission. Start with the problem. What has somebody come to you and asked you to do, fix for them? Whether it's getting a message out about their new program, whether it's some crisis communications, whether it's helping to promote a community event like vaccines and testing sites. Number 2, think strategically. This is where your skills as a marketer, the way you look at a problem and devise a solution, this is where you can talk about that. Then the plan. You have a plan when you address these problems. This in the Lamplighter, we ask that you tell us the plan. How did you move from one section to one item to another as you addressed the problem? Number 4 is creating the entry with all these items in your mind. You funnel them into those categories that we just discussed, and segment them in a way that makes it flow. Stay on message. We are not the ones, or the judges are not the ones who understand your problem and your solution. So you need to just keep reiterating things throughout the application. And then again, results. That is one of the most important elements here. And I've actually personally had some situations where I thought something was a great piece, but I didn't have results to showcase. And I thought that that wouldn't make a good Lamplighter application. The results are very important. Next slide, please. We have, as people who have been doing this for years and years, we've come up with some tips for success as you're doing your Lamplighter application. Number 1, outline your objectives, goals, audiences, strategy, and execution. Align the measurable outcomes that demonstrate actual results. Even if you didn't achieve your goals, showing the results that you did have is a win. Allow for time to develop and review your entry. So those of us who like to wait until the last possible second, if this is your first or second go around with the Lamplighters, it's probably not a good idea to wait until the very last minute. Choose your best entry for each category. As a writer, I find myself having more than one press release or newspaper article that I'd like to submit, but at some point you are competing against yourself. So I kind of winnow that down, and I know our team at Hartford Healthcare, we actually have a spreadsheet where people go in and they put in the things that they're going to enter, so we don't end up entering and competing against each other. You want to choose the best entry, the best possible piece you have in each category. Judges are held accountable for results every day, so communicate effectively, demonstrate effort, and highlight your results. Next slide, please. Using results terminology everyone understands. So again, these are going to be judged by people in other parts of the country, people at different levels in the organization. So I was judging when I was, pretty much just a public relations specialist. So it's not everyone has the same grasp of the terminology. So make sure when you're talking about marketing results, you use things like response rate or ROI, image and awareness, words like that, to convey operational results, show the number of appointments that were made, the volume of patient flow and how that increased, and patient SAT scores and comments are always great. Strategic results, you can speak to market share, out-migration, and profitability. Next slide, please. There's always a question about whether something is in-house or agency. Produced in-house is when the hospital marketing or PR people are on the team who are employed full-time by the healthcare organization. They're the ones who are responsible for the creative direction, who conceptualize the brochure, write the content, coordinate production. Something is agency produced is when you outsource that to an agency that creates and produces the brochure, publication, or campaign, and the agency is responsible for the creative direction and execution. There's always there's also some gray area with that. So if you have questions, you can always reach out to us about that. Next slide. Location of a hospital or agency. The question, our ad agency is located in New England, but one of the hospitals is located out of state. Can we enter our work for them in the Lamplighter Awards? The answer is yes. The competition is open to all public relations and marketing professionals employed by New England healthcare institutions, health plans, and agencies. Next slide. Time frame. This is when you might be eligible. The projects are eligible. Anything that's produced between October 1st, 2020 and January 31st, 2022, they need to be produced and or completed and show measurable results in that time frame. So there was one last year that we had that it was a great photo. It was a photographer asked on our team, wanted to know if they could submit the photo, but the piece had just come out and we had absolutely no way of having results. So hopefully he'll be submitting that this year in the competition. Next slide, please. A word about judging. Judges for the Lamplighters come from healthcare communications professional societies around the country. Each Lamplighter entry is judged by 2 independent judges who are responsible for judging the entire category. Judges are assigned categories based on their professional experience and expertise. And in turn, we provide judges for the awards entries in these other states. Next slide, please. Who was eligible for the Best in New England, the one that Mike won last year? Best in New England winner is selected from the 5 top scoring gold entries in the entire Lamplighter competition. These entries are reviewed again by a separate panel of judges who then determine the best in New England. Next slide. That is my presentation. I'm sorry, it is not my presentation. It's by the Lamplighter chairperson, Vanessa Stafford, who couldn't be here today. So I apologize if I rushed through some areas that she might have spent some more time with, but we are open to questions. And you can enter them into the chat and we can ask them later. But in the meantime, I would like to introduce our guests today. Mike Morrison, you're up first. Would you like to tell us about your Best of New England award and the process that you went through last year when you applied.
Sure, I'm happy to do so. Let me just share my screen here. I have a few slides. Give me a moment. I'm not necessarily the one always driving the bus on these things. I'm not that important. So let's see if I get this right. Can everyone see that? Perfect. One second. Okay. So again, I'm Mike Morrison. I'm the Director of Media Relations at Mass General Hospital. I've included my contact info here. I'll also put it in the chat for anybody who has questions after this or any opportunities to just chit chat or info share. I think that with everything that everyone here has been through, it would be kind of a shame if we didn't sort of share our successes and failures. So any opportunities to do so, I'm happy to, and I think many members of our team would as well. So just a quick overview, very quick. MGH is the oldest and largest teaching hospital of Harvard Medical School. We are a founding member of the Mass General Brigham Hospital System. We have certainly lots of beds, lots of employees. We see lots of patients and do lots of research, and all of which we're extremely proud of. Just as both a literal and figurative snapshot, this is our team in the Office of News and Public Affairs. I'll try not to commit the cardinal sin of reading the slide, but folks can kind of get a general overview of our responsibilities. It certainly represents just a fraction. But I will take this slide just to make two quick points. I'm certainly the one honored to present here today, but certainly the work we presented and what we were honored for was the result of people here. It's cliched, we're all messaging folks to say it takes a team, but it's really the truth in this case that we only could have the successes we did with the people we did. So the credit goes to this entire group, certainly. And then I also want to mention this was an in-house application for the crisis communications category. Though certainly our team were the leaders across the hospital, we didn't operate in a vacuum, whether it was colleagues in other departments who took on writing assignments or folks who just needed to do what they had to do across the hospital to either get us information or take video or assist us with video editing. It really was one of those village type efforts, and unfortunately it continues to be to this day. But we were, as you mentioned, we were honored to be the Best in New England Award winners last year for crisis communications. So this is the part where I think the title of my presentation is a little bit fraudulent. I don't know that I have great tips or even certainly not tricks to winning these awards. I think that really the truth of it is that the work we did really kind of carried us through. And I think the crisis communications category was a strong one for us because it allowed us to showcase basically every tool that we use to communicate with various different audiences. The challenge was so huge, and our team was able to rise to that challenge that, I'd love to tell you that we employed a, sort of a backdoor trick or some sort of way of winning this, but really we didn't have to shoehorn any information into this category. There was no creative writing that, made it fit it. It just sort of, I think, was a reflection. So I think what I'm going to attempt to do, as you mentioned before, these categories of the entry, I think I'll just share a little bit about how we thought about it and what was going through our minds as we did the entry. I'm certainly not going to make this about all the actual work we did, but more so how we thought about the application. So the situation analysis, really, I think all of us here are storytellers, and certainly in our office, that's sort of how we're wired. And so I think the strategy really was knowing that the judges came from our field and they kind of know our world, that what I and our team wanted to do was really put them in our situation. We wanted to let them feel a little bit about what it was like. And so for us, a lot of the work started in early 2020, but for me personally, I took the photo that you see there at the bottom, which was March 6th, 2020. That was when we sort of cleared out our ambulance garage bay and created a sort of a clinic for folks who were at a large biomedical conference here in Boston, which would go on to sort of be famous or infamous for being a major super spreader event. And I just happened to be in the area at the time where people were setting up for it, and kind of still remember through both the photos and the videos that I have and just sort of my own memory about what it was like, kind of like thinking, wow, this is actually getting pretty serious. And those were the days where you'll notice the chairs to the right are 6 feet apart and people were measuring them with measuring tape. And early on, I didn't really understand what the measuring tape was for and what they were doing, marking off so precisely. But now I think we all kind of understand what 6 feet of distance means, and it's sort of now part of our normal everyday life. So I try to put the judges in our shoes with the situation in their analysis. I try to make it a narrative, make it a story, and describe it. And I think whatever is the fifth, I forget what the word count limit is, but try to talk about what it felt like as we were ramping up through what would be going on 2 years of some really intense, but really important work. So the statement of objectives, once again, another opportunity for us to tell our story. So what were our challenges? What was happening at the time? How did it change? And so I think that change was a major theme for our application. We wanted to show that, especially I think as we all know in crisis, things change rapidly. The goals you have on day 1 and 2 aren't the goals you're going to have in week 2 and 3 or month 3 and 4, and certainly year 2. And so it was really, for us, it was trying to have the judges understand that every time things seemed to be going smoothly, the goalposts got moved, and we had to change what we defined as success, and we had to look at what was working. I think that a lot of folks have asked me and our team, certifications. Our team really shines. And I will that we were also fortunate enough to be honored with a number of Lamplighters in other categories last year. But I think given the situation that we were in sort of our industry and in the country and in the world, crisis really was at the forefront of everyone's brain last year and probably this year as well. So planning and strategy, how do we think through the challenges? Every time those goalposts got moved, what did that mean? How did the audiences change? Again, it's sort of that theme throughout our application of change and shifting priorities. How did we use our staff? What did we learn and change along the way? And sort of essentially trying to give the judges a sense of, this was not something you're planning out a pre-planned 6-month campaign that's really well thought out and you can measure things perfectly along the way and have results. It's really this sort of fly by the seat of your pants. As soon as something works, you keep with it. If it stops working, change it and move on, and just sort of keep going. Unfortunately, I think it kind of at the time mirrored what was happening clinically, in that the disease was so new that people were learning new things every day, and what worked for patient care a week before didn't work the week after, or there was something better to do. So I think change has been sort of to use the cliche, it's been the constant. So results. This is always the trickier part for me because I got into communications to avoid numbers. They're not a point of comfort for me, and I'm always envious of those who are really good with them. But we certainly wanted to share as much data and as much information, as much measurables as we had, both on the internal side and the external side, because it was really a gargantuan effort for every audience to come up with just the right messaging and just the right format and really hope that you're getting it to people in the right way. So things we certainly could share were some of our internal stats, like the page views for our Apollo intranet, which was huge. Our intranet really became the source of truth for really important information for clinicians or employees or general information. Do I come to work today? Do I not? Things like that. Hundreds and hundreds of memos going out to staff. I would say my internal communications colleagues essentially ran a daily newspaper that had to be changed every 20 minutes until it went out, whenever they could get it out, because everything was, shifting so quickly. And then a lot of our links to our training videos and our resources. We included links in our application so that if the judges want to learn more, they could sort of see our collection of what we did. And I also want to mention that I think the time period covered by our application was really that initial crucial first wave, at least for us here in Boston. It really started in January, some pre-planning, but then it's really that kind of March through June-ish time line that I think probably makes up the bulk of what our application was for. And then the external, we had been with a number of our staff members providing help tracking our media placements in those 3 months or so, or maybe 4 months, and there were certainly a lot of them. Our team was unfortunately never bored. there were incoming and still continue to be incoming media requests all the time, and then balancing that with the proactive work that you're doing. So you want to answer journalist questions, you want to provide information to the public, but at the same time, when you learn something new that your experts want the public to know, that you still have to sort of kick into that proactive mode, or work those messages into the media interviews you already have scheduled for your experts. So a ton of work done there. Links to the website. We had with the help of our marketing team, they had been tracking our press coverage on the website, which we had been publicly posting. So that was a really easy resource for us to just send a link to that website to the judges. Given the amount of media coverage we got, it's clearly unrealistic that they're going to be able to read every one. But I think that seeing the sheer volume there speaks to the work our team did. And then, of course, all the COVID-19 research press releases, we did something like 57 in that time period. We are blessed to work at a really robust research institution, but with that comes a lot of curious minds and a lot of work and a lot of really great and life-saving work. But the responsibility falls on our team to highlight that. So there was a lot there. And then probably the easiest one was the social media, right? Because they have all the analytics built in. So that was kind of a gift where we didn't have to track every tweet and every Facebook post as they were happening. We could, use the tools built into these to sort of see in hindsight what worked and what didn't. But, truthfully, the public was so thirsty for knowledge that, a lot of our social media went really, really well. And so we provided some videos too. Video work, we had some assistance across the institution, whether it was employees taking instructional videos and sending them to us and us trying to figure out the best ways to promote them, or we are creating the video or we're editing the videos, etc. So providing the judges with a link to our YouTube channel and a playlist with all the videos we created. Again, we understand that they're not going to have time to go through and view every single one, but just looking at the sheer volume and a brief look at some of the view counts, I think provided a really good window into the work we did. And then again, shifting tactics. This is one of the things that we really wanted to highlight was, how much change we went through constantly. And one of them was locally here in Boston, the city of Chelsea, just outside, largely non-English speaking, mostly Spanish speaking, had been hit particularly hard by COVID for reasons that existed before COVID, health inequities and such. So the institution itself pivoted to, once sort of there was the realization of this community and what they were going through, there was a real institutional pivot to making it a priority to communicate with specifically this group of people. And I think that as communicators, especially myself in the media side of things, I always want to think as big as I can possibly get, right? If I want a story, I want it in the Globe or the New York Times or as far and wide as we can get it. But it was clear that as things progressed, looking back and reevaluating our goals, if we really want to get information to this community to help save lives and help people protect themselves, then we have to shift our priorities. So if Dr. Joe Betancourt here has only 30 minutes a day, is it better for him to do an interview with the Boston Globe, or is it better for him to do a Facebook Live with a Spanish-speaking outlet and take the 30 minutes and do that? And so, it's a bit of shift in thinking, but once you have an institution like ours identifying these clear goals, then for us as communicators, it's really, okay, let's just flip the switch and switch the audience and put our tools to work and figure out how we need to change things. And so as a summary and wrap up, like I said, I don't have any golden tricks for you. I think the work our team did really spoke for itself, but I'd say try to put the judges in your shoes as best you can. They're communicators too, think of them as colleagues. We tried to provide a bird's eye view of what happened, kind of like I'm giving you here today, a very sort of brief summary. I think the biggest challenge we had with the application was that there are character limits, there are paragraph limits, there are word limits, and so it's hard to pack in all the great work that you do in a brief entry. But providing links where you can, collecting statistics, whatever you can, whatever you have that's presentable in sort of an easy format, then I think that's probably the best way to go. And having skipped over a point, I think highlight the solutions you came up with, but what did you fail at and what did you need to change? Because I feel like, especially in a category like crisis communications, it's stressful, but what I tend to like about it, and I think why our team thrives on it, is the unpredictability and the need to shift quickly, which they do very well. So I think all in all, that would be kind of my overall thoughts on this. although everyone on our team contributed to all of the awards applications, I had never actually filled one out before and been the person just collecting it and writing it down. So I don't have much to compare it to, but I was blessed with an easy task because of the fantastic work for our team. So I think that, I know it's obnoxious to keep saying that over and over again, but to not take every public opportunity to say so is kind of like a dereliction of duty. So pardon me for being obnoxious, but they're fantastic. So that's it.
Mike, I think that one of the best points you made was that you need to put the judges in your shoes so they understand the situation. I've been doing Lamplighter applications for like 15, 20 years. And that it was enlightening to me. I mean, that's exactly what we have to do. They have to understand what you're up against. And with the pandemic, a lot of communicators did, and the judges would understand. But there's so many other things that will that people apply for Lamplighter awards for that might be unique to them. So I think taking that bird's eye view, like you said, and putting the judges into your shoes is just crucial. That was great advice.
And I would just add, I forgot to mention quickly that for the actual situation analysis, on all our applications, we tried to be really creative in the writing and truly tell that story. Like put somebody in the scene, write about it like you're almost writing fiction, something like that. Because I think we get caught up in the formulaic nature of it, and we want to say bullet points, objectives, goals, wins, losses, etc. But that first part, I feel like you can really kind of exercise your creative brain and write a story.
Yes. And I see my colleague Melissa down below in the chat said she just live tweeted that out. So that's resonating with everybody.
Well, thank you.
So again, people, you can ask questions in the Q&A at the bottom, but in the interest of time, I'm going to now shift gears and ask John Sponauer to talk about his award-winning application from last year.
Great. Thank you, Susan. Thanks to everyone for attending and for the opportunity. I'll be honest with you, we were stunned and thrilled when we won. We knew that we did good work that mattered a lot to us, but to actually see the recognition from our peers was just incredible. And I guess before I go into the screen sharing process, just a thanks to everyone on this call for the work you do. We all worked in healthcare during a time that we'll never forget. I bet none of us went into 2020 thinking that the world was going to change the way it did. And the fact that we're all doing this work matters a great deal, not only for the people we serve, but for our organizations and really the country in general. So thank you to everyone for what you do. And actually, thank you for the competition, honestly, because I think it makes us all better. So I'm going to try sharing my screen now, and we'll get into the slide. I'll talk a little bit. Let me know if you can see the slide or whether I should switch screens here.
Nope, you're good.
No? Okay, great. Excellent. So just an introduction of myself. My name is John Sponauer. I'm Vice President, Marketing, Communications, and Philanthropic Giving for Wheeler. Wheeler is a complex organization. We are a federally qualified health center. We are on the front lines along with every other FQHC, providing frontline healthcare for 30 million Americans every year, generally lower socioeconomic status, but really we serve everyone who comes in the door. We are part of this network of thousands of FQHCs across the country. We're also different in that we're a longstanding community behavioral health organization, community social service provider. We are one of the largest special ed providers in the state. We're the state's crisis leader in terms of mobile crisis. We are the state's center for suicide prevention crisis calls, addiction referrals from the state of Connecticut's Department of Mental Health and Addiction Services. We do a lot of different things, and it's hard to know exactly all the things we do from just a general, really short overview of us. And a lot of people have exposure to one part of us, but don't necessarily know the whole picture. We are 110 programs, 1,000 employees, 36 locations or co-locations across the state. Of those 1,000 employees, we have about 2.5 that are devoted specifically to marketing communications. So I oversee the fundraising and the marketing communications for the organization. And so part of my time is dedicated to fundraising, part is dedicated to communications and marketing. So, really for me, the first thing that I always come to when I was putting this information together is passion. I know it's sort of pat, and I know that we all can talk about passion in abstract terms, but I will tell you that the passion that we have for our work came through, especially in the service line marketing part of that. And I'm going to talk a little bit about that one first. Assume everyone can still see the slides. So the foster care program that we run was the focus of our service line campaign. A little bit of a big picture overview of foster care. There are about 4,000 kids in Connecticut's foster care system. About 600 of them, as we sit here this morning, need homes. And it has always been a struggle to effectively market. It's always been a struggle to differentiate the needs, to really identify the right populations to reach out for foster care. And this was a great project for us. And the reason I talked about passion when we started was that this was really an internal production that was overseen by my associate director for communications, who has a personal passion for foster care. And the foster care team that we have here, not that everyone isn't passionate about their jobs when they walk in the door, but they're focused and they are dedicated, and they can see the results of the work they do every day in lives saves, homes placed for kids, and better outcomes for everyone. So in a lot of ways, they're very innovative in how they think. And when I came on board Wheeler, they were one of the first organizations, one of the first programs of ours to reach out to me and say, hey, you know what, we could really use some creative help in how we market foster care around the state. And not only are they passionate about their work, but they're willing to do a deep dive with us in marketing. So, for example, we would go in and we'd sit with them and we'd talk to foster parents. Well, who are you? You know, what are you passionate about? Why do you do this? This is a long-term, deeply emotional, deeply personal commitment to take in foster child or foster children in some cases. And when we actually started doing analysis on who is a foster parent, which ones are very successful, and what can we do to really get that message out there, we found some really key audiences that we have been able to serve effectively with marketing for the last 5-6 years. And especially in 2019, 2020, it really, with the pandemic, the foster care situation in Connecticut did certainly not get easier. And we were able to put together a comprehensive campaign on multi-channels that really moved the needles on some of our KPIs. And in the end, ultimately, most important for everyone, put kids in foster homes and made foster families feel supported. So it took a few different angles to it. First of all, when I talked about target audiences, this was an activity that the foster care program had, or really a lot of our community-based programs, had never really done from a marketing lens. So when we sat down and we said, well, what are your foster parents like? What are their hobbies? What do they do? What do they all have in common? Or are there segments that we can target more effectively? And we learned pretty quickly that there are, and some are very intuitive. For example, empty nesters very often are a target for foster care marketing, and for obvious reasons. But also, for example, the LGBTQIA+ community is a target for foster care marketing. And I don't think a lot of people necessarily thought of those markets as markets within the program. They knew who they saw coming to events. They knew who had really gone through the process to become a foster parent, but I don't think we really had considered internally, how do we market? And then we also sort of found some interesting affinities, and everyone in this call is in marketing in one shape or another. So when we actually started talking to people, well, what do they do every day? Like, what are the commonalities of your foster parents? And we found some affinities that we hadn't necessarily thought of, and we were able to use those in some social targeted advertising. And it was sort of like the light clicked when we first started looking and putting on the wall, well, this foster family does this and this foster family does that. And you started seeing commonalities that we could actually put to good use in marketing. So the campaign itself, it relied heavily on community events. We are out there at pretty much any community event supporting our foster care team with marketing material, with sponsorships, with whatever they need to get out into the actual community and meet people. Rubber meets the road, these types of events actually pre-COVID, may we all get back to the date when we're all going back to health fairs out in the community. But in that time frame, we were able to actually meet a lot of people at community events, go to chamber breakfasts, go out to the local festivals and be out there and talk to families one-on-one. Had a PR component. It's hard to actually visualize here, but we had a pretty significant PR component to get out there, get in the media, make sure that we were responsive to media requests for stories about foster care, make sure that we were able to highlight the activities and events that we were doing. Social was a big part of it. We did an ongoing weekly social post essentially about foster care. In most cases, we're able to then promote those posts to targeted audiences based on the topics. LGBTQIA community was a really easy target from social, for example, because it made it very easy to reach people that we knew were going to be able to be impacted and moved with that message. videos. We were able to do internal staff videos of our foster care staff, such as the one below in the center of the slide. Also, we're able to do videos with families and able to tell short, compelling, internally developed videos about why people are foster parents and what the journey is like for them. So we're going to talk about outcomes a little bit later. But one of the real concrete tactical goals was to increase attendance at a somewhat comprehensive multi-week training for new foster parents. We had a situation where, because of the longevity of the training and because the people just weren't aware of what was involved in it and what support they got throughout the process, we were finding that in some cases we actually had to cancel trainings. It just, there wasn't enough people to make it through or to had even signed up in the beginning. And we'll talk about outcomes with some of that in a later slide. But that was the tactical objective that we were trying to achieve, in addition to top of mind awareness, obviously, that everyone is striving for in their campaigns. But it was a great success. The staff person who was responsible for it, I think, put her heart and soul into this work every single day. We can see that it's compelling content. We can see from the likes, from the shares, from the comments, that people really are connected to what we're trying to accomplish in foster care. And I think that's what really came through in the application process. So I'll do Q&A afterwards if people want, or if you have a quick question, you can jump in now. But we'll move to our second service line that we received the award for, which is television advertising. And I was thrilled beyond words to receive the recognition on behalf of the team. And I want to kind of go back to what Mike said, is this is a team effort. And I mentioned my associate director earlier. She made that possible. And similarly, our television advertising campaign was a huge team effort. And I think Mike put it better than I ever could, that no one does this work alone. And I'm the one who's lucky to be sitting in the seat here talking to you. But this was a massive team effort on a lot of different levels. First is our creative partners. So this was a hard one to categorize, to be honest with you, because was it developed in-house or was it developed by the agency? Well, I certainly wasn't holding the camera. The agency put together the creative platform, came up with some initial concepts, but we really worked hand in hand with them to write, rewrite, go over, make sure that we were really touching the right bases with all of the creative on this, make sure we were doing it in a respectful way, make sure that our vision was being met. And I say I have a staff of 2.5. I actually have a staff of probably a dozen or more if I count our creative partners at Go Agency in Hartford. They are fantastic. They are the non-agency agency as far as I'm concerned. They did amazing work for us in this spot and all of our previous spots. So the strategic dilemma we were trying to pose here was Wheeler has been in existence for 50 years, but we've really only been doing consumer marketing for about 5, about 6 actually. And so we have a lot of room to grow. We have a lot of room to tell our complex story. So even though this wasn't a total organizational ad, it is in the sense it says Wheeler on it. It really was a service line ad in some ways for our family health and wellness centers, our federally qualified health centers. We had done TV commercials before. Go had produced some great spots for us, but we wanted something that we thought reflected the ground level truth a little better. And what I mean by that is you can do a lot of different TV spots and they look very smooth and they look very clean. We wanted something that really reflected the difficult work that our staff do every day. We also wanted to create multiple commercials and we also wanted to have a focus on recruitment. Now it's tough because we have a limited budget, limited time. And what we ended up doing was a very creative approach where we spent a few extremely focused shoot days making enough content with the same characters in multiple spots so that the stories are the same story is told from multiple perspectives. So the top one is called Hope, and it's focused on one person's journey through our system and the care that is provided, the integrated healthcare, behavioral health, primary care, non-traditional care, all provided in one spot in our services. The other 2 spots are very similar, but what they feature is the same story from a staff perspective. So we can also use this for recruitment, and we can tell the story of everyone who comes in our door, not only from that person's perspective, but from the perspective of our staff who are engaged in his care. And when you watch the spots, which I won't put you through in this short time, but when you watch the spots, you'll see similar scenes, similar actors. It's the same story told 3 different ways. It was a very efficient way of doing it. And one of the things that we wanted to have focused on is a real street level look at care. Entry level look at care. So we're filming right outside our centers. We're going on city buses. We're in downtown Hartford and on Park Avenue in Hartford, Park Street in Hartford, walking down the street, filming right in our health and wellness centers, making it seem real and personal. When I say it's a team, we also pulled our clinicians into this spot. So what that means is not necessarily just on camera, but what that means is we got their thoughts and their input on it before we even got to storyboard, to be really honest with you. We wanted to make sure the language was authentic. We wanted to make sure it was real. We wanted to make sure it handled the challenges that our patients and our staff see every single day. So there's 3 spots. One's called Hope. The general tagline for all of them is everything you need with everything we've got. And we're very, very proud of them. When people see them, they can immediately connect that this was that wording was exactly what I had offered to you. And that's what I want to hear. For example, with the addiction piece, the bottom spot starts off with a peer counselor on addiction. And one of the things that we heard from our staff was, addiction is a lifelong process. Recovery is extremely complex. And so the very start of the commercial basically says that the peer counselor says, and I've been in recovery for 23 years, but in my line of work, 23 days is just as big an accomplishment. And everyone who works in addiction and recovery knows that in their heart. And it's a better commercial and a better spot because of that. So, like Mike, I really don't have tips and tricks to share with you, but I will tell you this. The first step for this was for me to get involved. And what I mean by that is I got an email from NESHCO asking me to be a guest at the Carolinas healthcare equivalent of NESHCO. And I signed up for it because I was kind of interested. They also had said their award was the Wally and the Golden Tusk Awards. And how can you turn down anything with a walrus, right? I mean, it's different, it's innovative, it's fun. So I did their judging process. And I got to tell you, I was really blown away. And I thought, our stuff could compete with this. Our stuff is along the same lines as this, and we can learn from what they've done. So first step, get involved. Get excited. The last 2 years have really run down everyone in healthcare. I think we all feel it instinctively, but damn it, we're doing good work. We're doing really good work. And be proud of that. And don't undervalue that daily grind, because you're making a difference in what you're doing, and you're doing extremely high quality work. Think critically about the value you're adding to the process. Look around, look at the competition, look and see what people are doing. And I have to be honest with you, I really hesitated before I hit submit on these entries. So take a chance. You never really know. This was our first attempt at entering the Lamplighters, and we're thrilled that the recognition that was received for the work that was done by the entire team. Question to ask, obviously, everything in marketing is differentiation, differentiation, differentiation. What makes you different? I think our approach to foster care marketing is different from a lot of other organizations. I think our approach to making the TV commercials was different from a lot of other spots you see. Metrics and KPI. Okay, so here we go. So when we had previously done foster care marketing, we had to cancel several trainings. We actually were overbooked for the trainings that were held in this time period. We heard people heard about us on social, saw us in the paper. We came in, info session attendance was up 70%. Phone and email inquiries were up 30%. Training attendees were up 50%. Most went through the whole process. When we actually asked them, most of them had heard about it through the ads. On the TV commercial side, our overall brand recognition has grown considerably since we started doing marketing, and it took a big boost in the year that we did the TV commercials. 20% year-over-year increase in market awareness and our market research we do. The sad thing about it is we filmed this in the fall of 2019, and we did not film it with PPE on, because why would you need to, right? Nothing was coming like a pandemic. So we actually took them off the air for quite a while because there weren't PPE in the spots. We didn't film them, obviously, knowing what the future could be. So, so the metrics probably aren't as high for the TV spot as they could have been, but they're going to be back on, and we're going to go back to that message. Why should anyone care about what the work you're doing? And I guess most importantly, why do you care about this? Because the passion part really comes through. I hope it comes through in what I'm describing for the TV spots, and certainly with foster care. We all have this passion for this work, and I think we do so much good work that's overlooked very often, and this is your chance to shine in it. So come back to what gets you in the door in the morning. I know for me, it's making a difference in the lives of people, and who maybe this is the best care they're ever going to get. And that's what makes me commit to coming in every single day. And I think you all have the same kind of button, and put that toward your application process, because it's going to come through in everything you're writing down. So My contact information is here. You can find me on LinkedIn, obviously, phone number, email, happy to connect with any of you. And again, thank you for taking the time to join today and for being interested in the topic, and submit those great applications. It makes us all better.
That was awesome, John. I love the fact that this was your first application too. So that's encouraging to people. I think sometimes the application itself and the concept seems daunting, but once you start and you get into it, it becomes more of a natural thing to apply. So I think that, you know, your advice to just do it, just try it out and see how it goes is encouraging for a lot of people.
Great.
And Michaela in the chat too had said that she loved the fact that you suggested people get involved by doing the reciprocal judging. We're always looking to help because NESHCO is such a large organization. Our Lamplighters require us to partner with sometimes up to 4 different groups, similar groups around the country. So we find ourselves getting requests to judge, reciprocal judging for 3 or 4 different organizations. So we could always use the extra help.
It was a great experience, honestly.
Yeah, no, and it's very interesting to see what other people are doing. You get ideas and you see things that worked and things that might not work for your area. But I mean, I just think it's a good educational thing as well. You guys, Emily and Michaela, are there questions down in the chat? Because I don't see any.
I'm not seeing any questions in the chat, but everyone that's on the call, please feel free to enter them in the chat or the Q&A. We have some experts on the line that would be happy to share their insights. So if you have any questions, about any of the specifics, the technicalities of the application, please feel free to ask. That's why we're on the line here too.
And it's also important to note that it's being recorded and it will be up on the website too for people to share out and maybe even think about questions. They can reach out to us through the website as well, right, Michaela?
Absolutely. You can always reach out to admin@neshco.org.
And thank you to John and Mike for offering your personal connections too, because sometimes people might feel more comfortable just reaching out directly like that.
Thanks for inviting me.
Yeah, I still don't see any questions. That you guys, that means to me that we did a pretty good job today presenting the information. Hopefully it inspires some people too to get on to the link and to start working on their own Lamplighters. Is there anything else, Michaela or Emily, that we should? Oh, thank you. Great presentation. We have some comments down below. Yeah, there really was a lot of great information, and you guys did a perfect job of drilling it down to actual tangible information versus just the bird's eye view.
Yeah, absolutely. Thank you so much for participating, and for those that are on the call too. Like Sue said, we'll be posting the recording. So if you have any questions, feel free to reach out, comment on social media, any way that we can get some ideas flowing for everybody.
Mm-hmm. Absolutely. And good luck to everyone. Thank you, John and Mike, for joining us again. This was really great. And have you already started your own Lamplighter applications for this year? Or are you like me?
No, I started. We're going to be reviewing version 2 this afternoon, I think.
Awesome. Version
We're
2.
a deadline-driven group, so we'll probably wait till midnight just as they're ready to go.
On Valentine's Day. There you go.
Exactly.
How romantic. All right, everyone. Thank you for joining us. And keep your eyes open for upcoming webinars as well. There's a lot of information flowing from the organization. So keep your eyes peeled. And thank you for joining us.
Thanks so much.
Thanks, everyone.